COVID shots might get a whole lot harder to come by this fall if you are a healthy adult who is younger than the age of 65. Why? Well, the FDA says it'll now require clinical trials before it approves annual COVID boosters, which, of course, in turn is going to delay the rollout of any updated COVID vaccines. The new FDA commissioner and vaccine chief, in a paper published today in the New England Journal of Medicine, writes the benefit of repeated shots is, in their words, uncertain. And maybe not necessary, they claim, since the virus has been circulating for a few years now. Berkeley Lovelace is joining us now. There's a couple of pieces to pull apart here on this. But let's start with maybe the main one that has a health impact, which is, does this mean that if you are in your 20s, 30s, 40s, and you're healthy, you are not going to be able to access a COVID booster if you want it this fall?
So it's very likely it's going to be very hard to get a COVID vaccine this fall if you're a healthy adult or a child. So this is getting a lot of pushback because it goes beyond a recommendation. So the FDA is saying that it won't approve vaccines for adults and kids if drug makers do not do these trials. And these trials will take months, at least 6 months to do the trials. And the vaccine makers have to set them up, enroll participants, and then the FDA has to sign off on that data. So that goes well beyond a fall vaccine timeline. And so people who are at low risk, who may decide that they want to get a vaccine, won't have an option. People who are older adults, people who are at high risk, pregnant women, people with cancer, they will still be able to get a vaccine. But the people are getting pushback on this because they're saying it's limiting people's options to decide whether they get a vaccine or not.
It's also different from what we heard from health officials for years, which is the COVID shot's going to be kind of like the flu shot. You just go and get it every fall, and then you're more protected.
Right, and so they're moving away from that. They're saying that this is an annual shot for healthy people is no longer needed. So then the next question, right? We've talked about the next question. Then fine, what is the political overlay? Because you cannot talk about this without talking about the fact that you have now obviously a new leader of the health agencies, Secretary Robert F. Kennedy Jr., who has long been a vaccine skeptic and in some instances conspiracy theorist. Yeah, and so he is thought to be behind this. He did impose a new rule earlier this month that all new vaccines had to undergo placebo-controlled trials, and up until today it was unclear if the COVID vaccines would fall under that, and they did. And so McCary, FDA Commissioner Marty McCary, said today that he pushed this new change because there's such low vaccine uptake. He said there's a quarter of people in the U.S. who only get a vaccine each year, including less than healthcare workers, and he attributed that to low trust in vaccines and also in agencies like the FDA. And so he said with this new change, they're trying to build trust in institutions like the FDA.
What are we hearing from, let's say, former Biden health officials, if anything, or former, health officials in other administrations that are not the Trump administration?
Yeah, so there's a lot of pushback from outside experts and the former Biden administration officials. As I said, this is limiting people's option to decide. So in the fall, if somebody wants to get a vaccine, or if they want to protect somebody who is at risk, so their grandparent, they won't be able to get a vaccine to protect them. So there's a lot of pushback from that. Also, insurance coverage is also a big deal. A doctor could prescribe the vaccine off-label, but then a patient is looking at $100 to $150 for a COVID vaccine out of pocket, which is
a lot of money.
That's a lot of money for a shot.
But so given the storm of controversy, is there any chance? I mean, this just came out like 6 hours. Is there any chance the FDA reverses course?
I don't see that. In my opinion, I don't see them reversing. There is a meeting on Thursday to discuss the updated vaccines for the fall. I'm expecting a lot of outside experts will also push back on this idea as well. But it doesn't look like this will change anytime soon.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.